Thank you all for the patience. I promise no more speeches, almost done. So great. It's wonderful, these conferences. Yes, I was a pulmonary doctor. I'm saying, because now it's 5 years since I came from US. Now I'm forgetting which is right bronchus, left bronchus and all that. But, that's not important for me now is what is the revenue per pulmonologist is more important now. So I'm concentrating on those things now. Just kidding, but great as all the speakers and faculty here have contributed a lot. I don't know, for some reason, pulmonary is definitely leading all other specialties. Like people are saying in my admin hat, I'm favoring pulmonary, but no, all like in this hall also, we have people from all over the country. So network right from Srinagar to Kanyakumari and in between everyone, even politicians can not get along so much, but I think pulmonary is really shown that we are very well integrated. And even if I don't know many people, even through Facebook and all, I can follow in each part of the country, not only the bigger cities, but tier 2 and rest of the country. I mean, pulmonary is doing really well. Special, all of you should have a big round of applause for yourself. So. Government too, Dr. Paramjyoti is here, when I was in Osmania and all, it was completely different. Pulmonary was, it was just like tumulu dagal, cold and cough kind of thing, but it's changed a lot. I think one of the maximum change specialties is pulmonary, and it's in a great field. As in my admin hat too, I'm saying nowadays, like malaria and typhoid and these kind of things, many might not have seen even in India. Now it's changing. So nowadays it's in addition to intervention pulmonary and all, as Nagarjun said, sleep, critical care medicine / pulmonary medicine overlap, and these kind of things keep increasing. So I think there is a lot of scope in pulmonary. So, but there are so many doctors graduating, so we just need to differentiate ourselves, like all the leading luminaries here. They did something special to be in the front rows. You're also doing great work attending conferences like this and maintaining these publications, these kind of things now is important. Because there's so many students graduating, even though the scope is high, you need to be ahead of the curve for people to recognize, and you're doing most things good. So, and coming to the topic of interest, yes, I've never seen a conference dedicated for EBUS, and this is only linear EBUS, right? Not even radial EBUS, and also that's wonderful. I don't think there is a session like this. I'm sure you'll go much more enriched. My brief experience about EBUS was like in US and all, it was not compulsory in my place in Maimonides to learn about EBUS, but I wanted to because it was new at that time with thoracic surgeons, and it's not a good idea. I'm saying it's they're not very patient and all. I don't have all day to do, and so I had to do something like that. So in front of all the people here, so there is Olympus, Broncos, Ambu, and if there are some more companies also with artificial intelligence and everything else, I challenge you, if anybody can get splenic tissue, then we can give you a special award too, because I don't know, at that time, I did something I don't have all day to do. Okay, somewhere we went and got some tissue, and after 2 days when Dr. Shaw, you're the thoracic doctor, he says, do you know what this tissue sample showed? So I said, no, it was showing splenic tissue. So maybe I'm repeating this joke sometimes, but anybody else got splenic tissue through EBUS? Otherwise, I'll patent it for myself till such a time when some company comes up with devices to get splenic tissue. So, just kidding. But there is a lot of things changing. We never knew what was EBUS and all. Now linear EBUS has become ultrasound. For critical care doctor now, ultrasound without ultrasound. Putting a central line is people might have forgotten now. Same thing for intervention pulmonologists. I don't think there is any way around EBUS, and a lot of things have developed, and artificial intelligence and everything is growing too. So I think you have to be ahead of the curve, and you're doing most things right. So, and if any point, like anybody wants some more simulation, some more observership, fellowships kind of thing, all of our branches, well equipped with infrastructure, and most importantly, doctors who are patient to teach you all this stuff. So please make sure if you or anybody needs any benefit practice, or it's always better to do it under manicus or controlled atmosphere instead of randomly trying for some splenic tissue and all those. Okay, it's great. So pulmonary is in a good field. And just a little bit more about, the hospital itself, you're free to walk around. Is a state-of-art facility built for the future. And MR Linac, we are just inaugurating on 20th. It's one of the real game changers. So it's previously MRI technology could not be combined with linear accelerators. So because, as you know, MRI is like you can't even take metal and all those things. Combining linear accelerator with MRI was like a real breakthrough. Now approved by European and FDA approved also. So this is like a real game changer in cancer therapy, because that tumors, even between each radiation, it can calculate the edema, what's the inflammatory tissue, and what is the normal tissue. And also, this is in the future, MR Linac will be more in the news and all. It's a game changer in US and Europe. It will be inaugurated officially on 20th, and we are having some good results. Pre-inauguration also, we did some patients and all, very satisfied with the results. So that is one thing. And coming to, yes, one other thing here about Yashoda is we did lung transplant. Was a little new to us, liver transplant. We started in a serious way in 2015. Initially, first year we did 4 or 5 transplants, but nowadays we are doing about 15 to 20 liver transplants every month. So that's among the top in the country. And lung transplants and acute lung units and all, we have taken care more in second wave of COVID. We had 109 air ambulance transfers, and since then we did probably about 50 lung transplants. Now we have a good team with Dr. Balasubramaniam. Is from Amrita, is trained in Austria for lung transplant fellowship. Manjunath, Chetan is pulmonologist, and we have Vimi Varghese, exclusive team for anesthesia, critical care, and good lung transplant setup. And most importantly, Telangana is leading in many fields, including per capita income. I think now Telangana has highest among the big states, 30 million population plus, and healthcare wise too, both government and private are doing good. So, and donations, total number of cadaveric donations in the country, I think only Telangana and Tamil Nadu has more than 100 plus, and among because we have the biggest healthcare facility in Hyderabad. We have as a hospital, between Yashoda Hospital, all 4 branches, we have last year we had some 94 to 97, I think 94 cadaveric donations in-house. So I think because in India, as you know, for lung transplant patients, waiting too long is not an option, so they may die on the list. And also, wait list is probably the least in Telangana, and particularly in Yashoda Hospital, because the hospital itself we have almost 100 donations, so that would be an advantage, and we are flexible with the pricing and all, because it's upcoming transplant. We want to really benefit patients. So if anybody thinks you have patients which will benefit for transplants, I think quality-wise, I think survival-wise, probably we have one of the best, and wait time-wise will be the least, and also pricing-wise also for any kind of patients we are flexible. So that's a little bit off-topic, but lung transplants, because we are doing good and it's new in the field, I just wanted to talk a little bit. So as I promised before, maybe I did, I did not want to continue speeches for so long, so I'll stop it here. I'll let the high quality conferences go on, and we have a live session too in the evening, and I'm sure you'll go much more enriched. Thank you very much.